Welcome back to the deep dive. We're here again to plunge right into some fascinating source material and, pull out the insights that really matter, maybe even surprise you.
Yeah.
Today, we are diving deep into something just fundamental, absolutely core to life and healthcare: oxygen.
Mm.
Not just, the air we breathe without thinking, but its critical role, that life-sustaining power, especially in those really frightening moments of acute respiratory failure.
Yeah, when every single breath counts.
Exactly. So our mission today is to really unpack the complexities around oxygen supply, how it gets used, how it's managed, particularly in places where resources are, frankly, stretched incredibly thin already.
Right.
How do we actually ensure quality care, life-saving care, when the pressure is just immense? Get ready, because I think there are some real aha moments here that might challenge some common assumptions about healthcare delivery, maybe even about efficiency in general.
It's absolutely true. This topic, it's not just important, it's profoundly impactful. It touches the very essence of life support, really.
Yeah.
And our lens for this deep dive is this really insightful study. It zeroes right in on oxygen crises,
Okay.
looking at why they happen, the root causes, but also, and this is key, exploring potential solutions. It gives us a pretty unique, sometimes pretty sobering look into the real challenges faced day in, day out in low and middle income countries.
So it's not just theory.
Not at all. And what we're going to talk about, it's not just medicine, in a vacuum
Yeah.
or just technical stuff about equipment. It's really about understanding systems, these complex webs, and also human behavior, which plays a huge role.
Ah, interesting.
Yeah, and how all three intersect, often critically,
Mm.
in trying to provide what really should be accessible, life-saving care for everyone.
Okay, let's start unpacking that then. We all kind of get that oxygen is crucial, right? We need it to live. But in a medical situation, especially for someone battling acute respiratory failure, why is it specifically called life-saving? What's actually happening in the body when that oxygen supply gets tight or, cut off?
Right. So when a patient hits acute respiratory failure, their lungs, well, they just can't do their main job effectively anymore. Could be infection, injury, maybe chronic disease flaring up.
Okay.
The bottom line is they're not getting enough oxygen into the blood, and they can't get rid of the carbon dioxide efficiently either.
And that's bad news fast.
Immediately, it cascades through the whole body.
Mm-hmm.
Think about it. Every single cell needs oxygen to make energy. Without it, they literally start to starve.
Wow.
Within minutes, critical organs feel it.
Mm.
The brain is especially vulnerable. So you see symptoms like a racing heart, confusion, maybe that bluish tinge to the skin.
Same.
Exactly. And just this desperate fight for air. Without quick, effective help, which almost always means giving them extra oxygen, that spiral just goes downwards. Organ failure, and ultimately, death.
So giving oxygen isn't just like one option among many.
No, no. In those moments, it's fundamental resuscitation. It's buying incredibly precious time. It stabilizes the patient so the doctors and nurses can figure out and treat whatever caused the lungs to fail in the first place. It's the bridge to recovery.
And it sounds like it's not just about having the oxygen tanks nearby, is it? It's making sure that supply actually gets to the patient reliably.
Precisely. That's what makes this study so interesting. Its main goal wasn't just confirming that oxygen is needed. That's often painfully obvious in these cases.
Right.
It was about understanding its administration.
Yeah.
How is it actually delivered? Because knowing it's needed is one thing. Getting it there effectively, consistently, sustainably,
Right.
that's a whole different challenge.
Especially when shortages are a real threat.
Exactly. Acute oxygen shortages are a grim reality, especially, as the study highlights, in low and middle income countries. It's not hypothetical, it's a massive global health problem.
Mm-hmm.
And this study, it was designed to look right at that crisis. It focused on a very specific group, patients aged 20 and up, all suffering from acute respiratory failure and all needing oxygen therapy.
So the people most critically ill.
The ones right on the edge, yeah. Where oxygen isn't just helpful, it's often the first line of defense against dying. And the study's conclusion couldn't be clearer. Liquid medical oxygen is a life-saving measure in patients of acute respiratory failure.
Unequivocal.
Absolutely. It's not just an opinion, it's a confirmed reality from ICUs everywhere.
Yeah.
So by systematically figuring out where the system breaks down from the source right down to the patient's mask, the study aimed to find a clear path forward, really digging into current practices.
Okay, that perfectly sets up what they found next, which
Right.
honestly, I found it pretty shocking. The implications are huge, even though oxygen is this critical life-saving thing.
Yeah.
The study found it's wasted a lot. Not always because there isn't enough overall, but because it's used so inefficiently.
Ah, the waste aspect.
Yes. And this first statistic, it really jumped out at me. A staggering 80% of the oxygen delivery lines had what they termed a minute leakage. 80%.
Wow.
Can you help us picture that? Like, what's the real impact of these tiny, maybe unnoticed leaks adding up across a whole hospital, especially one already struggling?
That's the critical question, isn't it? How
Yeah.
does something minute, something small, cause such a big problem?
Yeah.
Okay, think of it like an old leaky faucet, drip, 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 annoying, wastes a bit of water. Now imagine not one faucet, but hundreds, maybe thousands of tiny hoses the oxygen lines running through the hospital,
Okay.
each one carrying this incredibly precious gas. And 80% of them have tiny leaks. It's not just a drip anymore. It's more like a slow, silent hemorrhage of a resource they absolutely can't afford to lose.
A hemorrhage. That's a powerful image.
Because that's what it is, systemically.
Mm.
The study mentioned things like worn seals on the flow meters, maybe tiny cracks in the tubing itself, or just connections not being tight enough where it meets the mask, or like nasal prongs.
Things that might seem minor individually.
Exactly. But add them all up across every bed, every hour of every day.
Yeah.
It's a huge volume of oxygen literally just vanishing into the air.
Yeah.
It never reaches a patient.
And the consequence.
When your supply is already tight, maybe you rely on one big tank, or deliveries aren't that frequent.
Oh.
It means less oxygen available for the next patient, reserves drain faster, and ultimately it directly compromises care. It's this hidden vulnerability eating away at the supply chain.
Right.
The fact that the researchers actually had to develop a specific protocol just to check for these leaks, that tells you this was probably a known issue, maybe just accepted, but not systematically tackled before.
So a silent drain with potentially deadly consequences.
Absolutely. Life or death implications from seemingly tiny leaks.
Okay, so that's the equipment side, but it gets even more complex, and maybe a bit, well, human. The study found 92% of patients took off their oxygen masks for things like drinking or eating,
Basic needs.
but they did it without turning off the valve. 92%. It feels like such a paradox, doesn't it? They need the oxygen desperately, but just living, doing basic things leads to waste.
It really does. And this throws up a massive challenge for the healthcare teams. How do you possibly balance patient comfort, basic human needs, hydration, nutrition are vital for recovery too, right? With the absolute necessity of conserving this limited resource.
Yeah, it's tricky.
And it's definitely not about blaming the patients. Think about it.
Ah.
You're struggling to breathe. That mask can feel claustrophobic,
Yeah.
heavy.
Uncomfortable.
Totally. You might pull it aside just to cough or talk to someone or grab a sip of water, almost instinctively.
Makes sense.
But this finding, it also shines a big spotlight on patient education and maybe supervision too. The study also noted, get this, 56% of patients didn't really know how to use their nasal prongs correctly, these simple little tubes,
Half of them.
over half. So what does that tell us about how we're communicating with patients?
It suggests a pretty good gap, right? Not just in handing them the equipment, but making sure they understand why it's important, how it works, and the simple things they can do, like turning off the flow for a moment to help conserve that oxygen.
So it's about empowering them too.
Exactly. It points to needing clearer, maybe more empathetic communication, especially in these high-stress, resource-scarce settings where every single liter truly, truly counts.
Okay, this is where it gets really interesting for me, maybe the most concerning part. There's a third major source of waste identified, and this one involves the staff.
Ah, okay.
They found that night nursing staff were a big cause of wastage, accounting for about 24%, nearly a quarter of the total leakage per patient.
Wow, 24%. Yeah. And often it was down to not checking for leaks from the masks during the night shifts. That's a huge chunk and pretty alarming given how vital nurses are.
It is alarming, absolutely. And it forces us to look really hard at the complexities of staff oversight, workload, especially in these environments we know are often under-resourced, understaffed, and just under constant pressure.
So it's not necessarily lack of care.
Probably not in most cases.
Yeah.
Think about the potential factors. Staffing levels on night shifts might be dangerously low. One nurse might be responsible for way too many patients, making it physically impossible to do constant, meticulous checks on every single oxygen line.
Just stretched too thin.
Incredibly thin. Or maybe the training on oxygen conservation protocols isn't consistent or hasn't been reinforced, or just sheer exhaustion. Imagine working a grueling 12-hour shift, dealing with emergencies, maybe short-staffed.
Yeah.
And then you're also supposed to meticulously inspect dozens of connections for tiny leaks all night long. It's a huge ask.
It sounds almost impossible.
It points less towards individual blame and more towards a systemic problem. Are the protocols robust enough? Is there continuous training? Is there clear accountability? And are these things even enforceable under such high pressure, especially with less supervision overnight?
Right. The system itself might be setting them up to fail.
Potentially, yes. The fact that this accounts for nearly a quarter of the leakage per patient, it just drives home these different sources of waste. The leaky equipment, the patient behaviors, the staff oversight issues, they're not isolated. They compound each other.
Creating a perfect storm.
Exactly. A perfect storm that hammers healthcare systems already struggling with limited resources. When you're fighting shortages, every liter is gold. These combined inefficiencies, they're a massive avoidable drain that directly hits patient outcomes and the hospital's ability to provide decent care.
It really highlights the need for solutions that support the staff, not just put more burden on them.
Absolutely. Systemic solutions are key.
So, okay, we've looked at the leaks and losses happening right there at the bedside and the day-to-day running of things. But what if the problem starts way earlier, before the oxygen even gets through the hospital doors?
The supply chain itself.
Exactly. The study points to a deeper issue, the actual infrastructure. A key finding was, and I'm quoting here, the unavailability of liquid oxygen storage facilities in hospitals was a cause of delayed supply of oxygen during the crises.
Right. That's critical.
For listeners maybe not familiar, what exactly is liquid medical oxygen, or LMO, and why is having proper storage for it so important, especially in these vulnerable places?
That's a great question because it shifts the focus from usage to, well, the fundamental supply. Liquid medical oxygen is basically oxygen gas that's been cooled down to an incredibly low temperature. We're talking around minus 183 Celsius or minus 297 Fahrenheit.
Seriously cold?
Extremely cold. And that turns it into a liquid. The magic of this is density. 1 liter of this super cold liquid oxygen expands to roughly 860 liters of breathable oxygen gas at normal temperatures.
Wow, that's a huge difference in volume.
Massive. And that's precisely why its storage is so game-changing for hospitals. Instead of dealing with dozens or hundreds of heavy, bulky, high-pressure gas cylinders, you can store a vast quantity of oxygen in a relatively small, insulated tank.
Much more efficient.
Immensely more efficient. These large liquid oxygen tanks, often called VIEs, vacuum-insulated evaporators, can hold enough oxygen to last a hospital days, sometimes even weeks, depending on usage. This drastically reduces the logistical headache and cost of constantly getting deliveries of cylinders.
So, connecting this to the bigger picture, why is having these facilities so vital in low and middle income countries?
Because without them, hospitals often rely solely on those cylinders. Maybe small ones, maybe larger ones, but still cylinders. This makes them incredibly vulnerable. Think about supply chain disruptions, roads get washed out, fuel prices spike, the supplier has issues, maybe there's political unrest.
A number of things could stop deliveries.
Exactly. And if your hospital depends on deliveries every day or two and one gets missed, you run out fast. The consequence, as the study states clearly, is delayed supply during crises, the worst possible time.
Right when you need it most.
Precisely. Imagine a sudden surge, a bad flu season, a new respiratory virus outbreak, and your small cylinder supply is gone, the next truck is days away. That directly impacts patients. It leads to preventable suffering, preventable deaths. It completely undermines the hospital's ability to provide even basic quality care in an emergency.
It cripples them.
Fundamentally. So that conclusion from the study, proper supply, storage facilities, and usage protocols have to be followed to rigorously avoid acute shortages. It's not just advice for one hospital manager. It's really a call for investing in national health infrastructure, building that resilience, preparing for the next crisis, and actually delivering on the promise of life-saving care.
And building on that point about protocols, the study didn't just identify problems, it developed solutions too, right? Those usage protocols you mentioned. They talk about using something called the ROX index and selecting the right interface like nasal prongs, face mask, or an NRB mask, all aiming for that target oxygen saturation of 92% or more. Can you break down why these kinds of detailed clinical protocols are so important, especially when resources are tight?
Yes, this is such a vital part of the solution, tackling that management of resources right at the bedside. The value of these protocols is huge for several reasons. First, standardization.
Okay.
It means there's a consistent, evidence-based way to deliver oxygen no matter who's on shift, no matter the patient. That reduces random variation, which improves quality and safety. Second, they optimize delivery.
How so?
Instead of just guessing or using a standard flow rate for everyone, these protocols help tailor the therapy. You mentioned the ROX index. That's a great example.
Explain that a bit.
Sure. The ROX index, it's a fairly simple score. Clinicians can calculate quickly.
Hmm.
It looks at the patient's respiratory rate, their oxygen saturation level from the pulse oximeter, and how much oxygen they're currently receiving through their mask or prongs.
Okay. Combining a few key metrics.
Right. It gives them a real-time snapshot. Is this patient getting better on this amount of oxygen? Or are they working harder to breathe, suggesting they might need more support, maybe even ventilation?
Ah, so it helps predict deterioration too.
Exactly. It helps make those critical, data-driven decisions right there, right then.
Yeah.
Do we need to increase the flow? Should we switch from simple nasal prongs to a face mask that delivers more oxygen? Or maybe even a non-rebreather mask for really high concentrations? Or is it time to escalate to something like non-invasive ventilation or even intubation?
So it avoids both giving too little and wasting oxygen by giving too much.
Precisely. It helps ensure every precious liter is used effectively, maximizing the benefit while minimizing that waste we talked about.
Mm.
Using the right interface nasal prongs for low flow, different masks for higher flows,
Yeah.
is also part of that optimization, making sure the oxygen actually gets into the lungs efficiently.
Makes sense. But the challenge must be implementing these protocols consistently.
Oh, absolutely. That's the hard part, especially in environments with staffing shortages,
Mm.
high patient numbers, maybe older or varied equipment, and limited opportunities for ongoing training. It takes real commitment.
Yeah.
But, and this is the study's crucial point, despite those challenges, these protocols are presented as essential for providing quality healthcare in resource-limited settings. It's about using clinical knowledge, using systems, using data to make the absolute most of what you have, turning oxygen delivery from maybe a somewhat haphazard process into a precise, targeted, life-saving intervention.
Making the science work in the real world.
That's the goal.
Okay, so let's try and bring this all together. We've looked at why oxygen is vital, the hidden ways it gets lost, the infrastructure issues, the human factors. What does this deep dive into oxygen crises really tell us about the bigger picture? About delivering quality healthcare when resources are scarce? The core message seems clear. Oxygen used properly is a life-saving measure.
That really is the heart of it, isn't it? It's both a statement of fact and a call to action. What this study hammers home is that oxygen's potential is entirely dependent on the system around it.
It's not just the gas itself.
Not at all. You need it available, stored right, delivered efficiently, used precisely. And when we pull together all these findings, we see these clear areas needing focused improvement. Systematically tackling leakage, every single linky connection.
Right down to the math.
Absolutely. Prioritizing patient education, really making sure people understand their treatment and how they can help, providing ongoing practical staff training and support, recognizing the pressures they face, especially at night, and making those crucial strategic investments in infrastructure like reliable liquid oxygen storage.
It feels like these lessons learned the hard way with oxygen could apply much more broadly, couldn't they, to other critical resources?
Oh, definitely. This provides a powerful framework for resource management across healthcare, well beyond oxygen. Think about applying the same kind of scrutiny to essential drug supply chains.
Or equipment maintenance.
Exactly.
Yeah.
Ventilators, monitors, diagnostic tools, even how staff time is used most effectively. This study pushes us to think critically. How can systems, especially in lower resource settings, learn from these specifics about oxygen to build healthcare models that are just more resilient, more efficient, more equitable overall?
It's about continuous improvement.
It is. That iterative cycle.
Mm-hmm.
Implement protocols, measure what happens, learn from it, refine the strategy. The study itself models that process. It shows that providing quality healthcare in resource-limited settings isn't some impossible dream.
It is achievable.
It is achievable,
Uh-huh.
but it demands this relentless, meticulous attention to detail at every single level, from how you talk to a patient to how the night shift is staffed, right up to national planning for oxygen plants and storage.
And those investments aren't just costs.
No, they're fundamental investments in public health, in being ready for the next pandemic or crisis, in the basic right to life-saving care for everyone, everywhere.
So we've taken quite a journey here, from why oxygen is so basic yet vital, to all these, frankly, sometimes surprising ways it gets wasted or mismanaged, and the big systemic hurdles in supply and delivery. The big takeaway seems to be, ensuring that life-saving oxygen gets where it needs to go isn't just about having enough tanks. It's about managing every single liter with incredible precision, clear protocols, and a real understanding of all the factors involved: human, technical, systemic. So thinking about this, what does it all mean for you listening right now, whether you work in healthcare or a completely different field? Think about those broader implications. Where else in your work, your community, maybe even your own life, might there be similar minute leakages? Similar inefficiencies that kind of fly under the radar but add up to a significant loss or stop something important from really working as it should.
That's exactly the thought to leave with. It's powerful. Because while the challenges this study highlights are huge and the stakes couldn't be higher, it also offers a clear path forward. It shows that the ability to provide truly good care, even when resources are tight, often comes down to these seemingly small things.
The details matter.
Hugely. That tiny leak nobody fixed, that valve left open, that moment of confusion about how to use the equipment properly. These details, overlooked and compounded, can literally be the difference between life and death. So the question for all of us is, how can understanding these micro-inefficiencies, these small points of failure in one critical system, change how we approach the bigger challenges we face? How do we find and fix our own hidden leaks to make sure our efforts, our resources are truly hitting the mark? Thank you for joining us on this deep dive.